Good morning, everybody, and welcome to Weekly Wake Up. This is our live stream for BVSD employees, and as always, our goal is to provide updated, relevant information about the reintroduction plan and this pandemic to our staff, as well as opportunities on certain weeks for us to learn from each other and evolve as we have to meet the needs of the day. This morning, we are super pleased to have to welcome back our partners in public health from both Broomfield and Boulder counties to help us walk through the impacts of the increasing cases of COVID-19. If a question pops into your head throughout the show today, we do want to remind you that we are accepting questions throughout. You can send those in via bit.ly, that's bit.ly/BVSD Wake Up, just like you see it on the screen here. Again, one more time, we had some folks have trouble with that before. bit.ly/BVSD Wake Up. Also, we sent out an email this morning just as a reminder, and the link is inside of there if you have trouble with it at all. We do want to begin by introducing all of our panels today. So I'm going to stop sharing here. And as I introduce folks, if you guys want to sort of introduce yourself, I'll just mention your name and then just kind of tell me what your title is or whatever. And I'll start with Broomfield County Public Health. Jason, good morning.
Morning, everybody. Yeah, my name's Jason Valling. I'm the director of Broomfield County Public Health, and my pleasure to be with you guys today.
And I don't know if Helene is on the line yet. Helene, are you here?
Yep. I think she was.
Oh, good.
Good morning. Hi, everybody. I'm Helene Lanzer. I'm the Public Health Nursing and Epi Administrator and work directly with the schools with other staff on my team. Thank you for having us.
Thank you for being here. From both, I'll say I made a mistake earlier of just giving him to one county. He works for both. Chris, good morning.
Hi, I'm Chris Urbina. I'm the medical officer for both Broomfield and Boulder. Glad to be here.
Awesome. From Boulder County Public Health, Jeff.
Good morning, everyone. Jeff Stayak, Director of Boulder County Public Health.
Good morning, Jeff. Heather.
Good morning, everyone. I'm Heather Crate, the K-12 Education Liaison Officer.
Good morning. And then I just want to mention real quick that we do have a number of members from our BVSD team. Margaret Crespo is joining us by the phone, so I won't make her say anything. I know that Robin Fernandez is here. Hi, good morning, Robin. How are you? We've got Sam Messier. I think Mike Grados is going to be.
Good morning, everybody.
Oh, good morning, Sam. Sorry. Good morning, Mike. How are you?
Good. Good morning.
Rob Price is on the phone.
Good morning, Randy.
And Stephanie Farron. Good morning, Stephanie.
Good morning, Randy.
All right. So as you know, this last week there was some pretty big news. Statewide increases prompted our counties and others across the metro area to move to safer at home level orange. That is previously level 3, the high risk. Because of the seriousness of the situation. So without further ado, we're going to have Jason from Broomfield County Public Health talk to us about what they're seeing there, and then Jeff will follow him with sort of the latest.
Great. So I'm going to try and pull up our public health website. So one sec. Are you all?
We can see you.
Seeing this now? Okay, perfect. So as was mentioned, Broomfield's now at safer at home level orange. What has been extremely concerning to us is how quickly we have seen our 2-week case incidence rate increase. What you can see is from October 28th, we were at 295.4 as far as our 2-week case incidence rate. Over that 2-week period of time and up to today, we're now at 494.6. The second thing I want to really highlight too is our percent positivity. So we were doing really well as a county, staying below the 5% threshold, which is when you can really detect cases in your community and show that you have enough testing capacity. Well, we surpassed that number on roughly October 25th. And since then, we've been increasing. And as of November 7th, we're at 8.13. Our hospitalizations, we have 11 days of stable or declining hospitalizations. And Jeff's going to go into greater detail of what's happening statewide and why this is so concerning. I do want to let people know that we have a town hall that we're hosting tonight at 6 p.m. with our residents, and then we're going to have a Board of Health meeting tomorrow night to provide an update. We did send out a press release to say, given that we've seen this 116% increase between October 21st and November 4th with our cumulative incidence rates, we're very concerned. We're in orange, but in 2 of our metrics, we're actually within the stay-at-home level. And so given that, we're looking to take proactive measures with our mitigation strategies. We're ramping up testing, our Reverse the Trend campaign, promoting the state's mobile app for contact tracing, and additionally looking at what potential policy options we need to take given our numbers. What we don't want to see ourselves is get to a place that we're not able to stabilize or reverse this trend in 2 weeks, and us along with other counties are contributing to increased demand for hospital beds and hospital surge. We also, lastly, and I'll turn over to Jeff, did present to the Adams 12 board last week, and in that presentation we shared some of our key takeaways, which include what we're seeing is from the research and literature is low transmission among elementary kids. Again, this is in studies, and some of the state outbreak data mirrors this. Obviously, schools can be safe when all of the appropriate mitigation strategies are in place, which we've been seeing with our school districts. And then obviously the benefit of in-person learning. Given that too, the other considerations we're always looking at and discussed with Adams 12 were what are the potential disruptions to operations for schools, the capacity of local public health to handle contact tracing and case investigation, and then looking at how we are building more towards point of care testing and can expand that. So that's the Broomfield update, and I'll turn it over to my colleague, Jeff, and I'll stop sharing my screen.
Thank you, Jason. Appreciate the update. What you're going to hear from me is much of the same story, and I'll share our data here with you. Maybe. Hold on one second. Hold on one second. Sorry, I'm not sure why this data set is not showing up for me. Bear with me just a second.
Do you want me to go and bring up the slides, Chef? That'd be helpful.
If you can, yeah, I don't know why my PDF isn't showing up here, but
No problem.
thank you. I appreciate it, Randy. All right, you can go to the next slide. So again, what you're going to hear from me is much of the same story that you've heard from Jason. You can see that our rates, we have one indicator that is currently in stay at home, and what you're going to see with us as well is that we have significantly increasing rates that are and the increase and the steepness of the increase is what's really concerning, as Jason talked about. So our incidence rate is currently in a stay at home level. We are categorized right now as orange, which means that we have to do a mitigation plan for the state health department, as Jason mentioned. As a metro agencies, we are working together to try to align our mitigation plans, and we're doing the best we can to do that. So I want everybody to know that. Next slide. This is the metro graph, which just shows, and again, you can really get the severity here by looking at that red bump on ours. That was that significant outbreak with the University of Colorado, and that now looks like a much smaller bump comparative to where the rates are across the metro right now. Next slide. This just is demonstrating that for the most parts, we are starting to see some increases again in some CU cases, but for the most part, we've been able to effectively control the outbreak at the University of Colorado. But what we are struggling with is the same thing as Jason and others in the metro area, and that's a generalized increase across most all of our age groups at this point. Next slide. This again just demonstrates that CU outbreak, and it's down to a baseline. Next slide. And then this baseline is what's broken out here. And the biggest challenge that we're seeing right now is I know it's a little difficult to tell, but the green line that's on the bottom and the orange line that's our 0 to 17 age population lines are increasing pretty steeply. So we need to keep a close eye on this. Obviously, this is not the kind of data that we want to see, and it's consistent, as you can see, with all those age group categories across the board, which are also increasing. And when I get to the end, I'll talk more about why this is so important as we move forward into these next several weeks. Next slide. This just shows where the outbreaks are coming from. So you can see that the city of Boulder and city of Longmont are the two largest sources. They are larger than Lafayette, Louisville, Superior, and other municipalities in unincorporated Boulder County combined. Next slide. This is our hospitalization. So similar story as what Jason shared. When we were at the height of hospitalizations in the earlier part of the outbreak, we were at 68, and we're currently at 78 now in Boulder County. So again, challenges with both increases in the rates that we're seeing as well as the hospitalizations that we're seeing locally. Next slide. So wanted to talk about this specifically because this is the context of what I know you're all most interested in. The Colorado Department of Public Health and Environment this weekend released a paper, and that's where this data is coming from, that talks about COVID education or in-person learning in the time of COVID education, and it goes through the costs and benefits. I know this first bullet on the top is what you all are very well aware of, and you know this. We've definitely been hearing how much better kids are doing when they're in person. The stories that have been illustrated by Randy and the district folks over the weeks have clearly demonstrated that, but we're also hearing that same thing from teachers, parents as well. And the challenge that we have in front of us right now is what happens with this virus in our community as we move forward. So as Jason mentioned, the difficulty of getting control of this right now is the fact that we have generalized increases across all of our populations, which means that it's going to take population approaches to be able to control the virus and get a handle on the spread. That's why we're talking about mitigation factors and how we're going to look at that. But we know that students and keeping students in school, especially at the K through 5 age, is critically important. And that's what that lower piece is. This comes directly out of the Colorado Department of Public Health and Environment paper that I just mentioned. It was just released this weekend, so this is brand new. I've sent it to the district, so I know you could make that available on your website if you want, Randy. But it just is emphasizing again the importance of especially that K through 5 education, even in situations like we're in right now. So you may have heard and seen that there's other countries that have gone fully to stay at home, but they've kept their education systems open because of the importance of what you see on this slide right here. So I just want to emphasize that again. What we're hearing and seeing is that there is more transmission that appears to be happening outside, and that is in fact some of the information we're getting. What we're hearing is just some disturbing stories from conversations with parents who have positive kids, but they're not taking it seriously, and they're letting their kids go to sports activities, or they're having their kids go to meet with other friends, and that's ending up spreading the disease. We know that the schools themselves are in a controlled environment. The schools have worked really hard, as you all know, to make sure that they're doing everything that they can to reduce the risk of the virus within the schools, and they're doing a great job. But the challenge that we have is, as a society in general, is really taking this seriously. So when we're all out, it comes down to us, and you can go to the last slide here, Randy. It comes down to all of us really taking responsibility for those decisions on the bottom right-hand side there to stop the spread of this virus. When you look back at the data across the history of this, we know that when people get together, and we can see the bumps around July 4th and around Labor Day in the data, that when people relax or they get fatigued, we know people have COVID fatigue. I think I said this the last time I was on this, was people are tired of this virus. They're done with it. They hate it. I do too. I know every single one of us on this call does, and we want it to be over, but we can't. We've got to stay diligent. We can't let down our guard, because if we do, it puts our entire society at risk. It puts our ability to have kids in school at risk. It puts our businesses at risk. And there is hope. There is hope coming. We will eventually get to a vaccine, but until we get there, we have to be diligent and really pay attention to doing everything we can to reduce the spread of this virus. So I'll stop there, Randy, and see what kind of questions we have.
Perfect. I really appreciate that, Jeff. I think that really sets up the kinds of questions that we've been getting. And in fact, I'll just dive into this one. And I think it might be for you and your team in public health. Myra at Boulder High School asked, since the county has already surpassed the metric previously listed as a marker for returning to remote learning. And I think this goes back to, we've had a couple different models of things previously that you come in, both you and Jason have kind of spoken to the board about. They're wondering about specific metrics that might be used to move us to remote learning. I don't know if it's too bold to say, but I don't know that there's actually metrics that we're using anymore that are tied directly to whether or not we're going to stay in school. Does that some kind of where you stand as well?
Yeah, I'll jump in first, and then Jason can jump in as well, because Jason, as you all know, has been working with Adams as well, so he's been working with districts. But yes, that is true. So what we're doing is we're using the dial as a guideline, and then we're looking at the research, and we're looking at what's happening in terms of transmission. So again, we are seeing the same thing that CDPHE is summarizing in that document, that our schools are not super spreader sites. That's not what's happening. And we know that there's a massive benefit to keeping schools in person as much as possible. We are focusing though on looking at, like when CDPHE says it's a little bit higher, you'll see this in the document, it's a little bit higher risk in elementary, and then the highest risk, if you look at K through 12, is in high school students, which the research has demonstrated is a little more closely to spread like adults. But we are watching all those things, and what it says based on where we are on the dial right now is that it's hybrid, remote or in person as necessary, or as appropriate, I think is the language. But we are staying close, as you know, we're staying in close contact. We're talking multiple times a week. We're watching the data, we're watching what's happening, and we're making decisions based on that. Now, I'll just see if anybody else has anything to add to that.
Yeah, I would just add, Jeff, the state health department recently in their public health order defined schools as essential services or critical services, really emphasizing the importance of in-person learning, or as much as possible, the hybrid approach. That I think is very important for the public and community to understand, because when you see the dial, obviously it can become very concerning, and that's what we were seeing in Adams 12 with the Adams 12 rates. The other thing I would add is, back to Jeff's point, is the importance of us reducing community transmission, because in Adams 12 specifically, what we saw was not so much what was happening within the schools, it was out of the schools and the disruption it created for the ability for the district to operate efficiently when you have teachers that are out and quarantined, and students as well. And so that's I think the systematic aspect of this is we're all tied together in the community. So as much as we can reduce that community transmission, that helps us keep schools operating.
I know that I've seen some questions out there, not specifically from our staff this morning, but in regards to the idea of that if we do remove or move to all remote learning, that there is some concern that because then families are sort of on their own and having to find their own daycares, that there can actually be some negative consequences to that as well, versus everybody being in a school where you know where they're going to be and they're in the cohorts that we've set up. Is that accurate? Because I know that our staff is very concerned about, as these numbers, rise, the threat, the risk to them themselves, and obviously this coming into our schools. But there's sort of a balance here, right?
Yeah, there is. I'll see if Helene or Heather want to answer, but I'm happy to if they don't want to. Or Chris got his hand up.
Yeah, I just wanted to add, but I don't want to preempt Heather or Helene, so I'll go after them. Go ahead, Heather.
Sorry, couldn't find the mute button. Yeah, I think what I would say is exactly what Jeff said, that we are seeing that school settings, because of all of the layering of protections, the health screening, all of the mitigation factors, are safer than other public environments. And so having students in those spaces, in cohorts, in a way that we're monitoring their movements versus out in the community, maybe getting dropped off at grandma's house or a neighbor's house or home with some other older siblings or students, we don't have as much information about what disease spread could look like. So that is one of the pieces in considering staying in person.
Chris, did you have anything else you wanted to add on top of that?
No, I'm glad I didn't say anything in front of Heather. That's exactly what I was going to say. I think to me, it validates all the things that the schools have done to get the message to parents, to kids, in that controlled environment. We model what we should be doing out in the community. And that's the connection in my mind. If we did everything that we're doing in the schools in our community, we wouldn't be talking about being in orange or red. We'd be in green or yellow. So I'm thinking, why can't we do this differently?
I'll add to that, sort of, I think that the feeling that's out there is this idea that as the level raises, that additional layers need to be added. And so I think Jeff mentioned that we are in conversation multiple times a week, if not multiple times in a day, having conversations and thinking through, additional things. Is there, as we think about the layers that are there for the teachers, and we think about the things that we're doing with our students, is there anything that you guys would say to them in regards to, the fidelity of those things, or things that they could do just to sort of, continue to make sure that they and their students are safe? Jason?
Yeah, I think it's everything we've been saying before. At this point, we know schools are extremely safe with the mitigation strategies that are in place. As Chris eloquently said, if we could take what schools are doing and take it back into the community in our home setting, and that's what we're seeing in some other districts with the disruption is not what's happening within the schools, but what's happening outside the schools, where then students and teachers are having to quarantine or having to isolate. So it's, how do we take that behavior that we have actually happening within the schools and practice it at home? So again, it's limiting your interactions, and right now in Broomfield, what we're saying is keep it only to your household for the month of November. Let's try and reverse this trend. So shrink your bubble as much as possible at home. And that, I think, is one of the most critical things, in addition to wearing masks. And we wear them within our school setting, but sometimes we let our guard down when we have a family member over and the mask comes off, and that's a potential for spread right there. And then what we know works most is the frequent washing your hands and hand hygiene, so cleaning. And if we could take those practices, like Chris said, back to the community, I think we could really put our teachers and students in a really good position.
And I'll bring in Stephanie Farron just for a half a minute here, just in regards to some of our messaging lately has been aimed at, talking about the fact that there are ways that, if we're at all lax in regards to how we're looking at cohorts, that can be a little bit strengthened, that, and again, no, we're not blaming staff by any means. I want to be super clear about that. I know that some of our messaging has been has offended some. And I want to say for myself, that from communications, that was definitely not our intent. I know that the superintendent said that in his message last week, but the idea of just thinking about those situations where, if you're sitting down to eat lunch or whatever, that there are, ways that we can keep that safer, go outside, be, distant, from each other. Stephanie, what would you want to add in that regard, in regards to ways that we can kind of strengthen this a little bit?
I think what you said, Randy, is perfect. I know that everybody, like Jeff and Jason mentioned, we're tired of being alone. We want to connect with our team members and our department folks and our friends. And unfortunately, this virus really wants to jump from person to person. And so anytime that we're together, that we have our masks off, we really need to make sure that we're at least 12 feet apart, that we keep that time frame really low. And I wouldn't do it inside. As often as we can, if the weather is nice enough, go outside and sit really far apart from each other, and otherwise stay separate. One department, one team the virus can go through really quickly, and then the school is in a really bad spot, and teachers are having to work from home again. So, unfortunately, it is just like everyone has said. We really have to be extra vigilant right now.
And it really doesn't discriminate. But I will say again, being out at schools this last week, it was, great to see staff having that social moment, eating lunch together, but very far apart, so that they could talk, but still be, outside and that kind of thing. So, definitely have seen that in person. Okay, I'm going to go to a question that we got from Retta from Manhattan. She asked, can you please explain why the new safer at home guidelines and protocols for high school athletics and activities that limits really how many people can be together indoors or outdoors, and timeframes and those kind of things are drastically different from the guidelines for school operations, and which oftentimes has more than 10 kids together versus the ones that for athletics that really limits that for multiple hours, et cetera. Anybody from public health able to sort of talk to that a little bit?
Sure. One of the big differences is what aspects of the school day are considered critical. And so that in-person learning classroom time is looked at differently than athletics. The other piece is that for the most part during the day, we're keeping students in those cohorts, in those stable groups. And then when we move into athletics or extracurriculars, those are students mixing from all different cohorts, all different groups throughout the day. And so those activities, and then adding in the layer of what activity they're engaging in, which is maybe running or other high exertion activities are higher risk. So there are different recommendations or requirements for those two activities, although there is information in the new public health orders that CHASA related sports are different than general recreation and sports activities in the community. So we are watching closely and waiting to see what those look like.
And I think the thinking there was that like football, for instance, had a special state exemption that they're abiding under.
Yeah, so football is allowed to finish the season, is what's been sort of directed at this moment in time, although that could potentially shift if things remain to get out of control.
Okay. Laura from, sorry, somebody want to join?
I was just going to add, similar to how we work with Stephanie's team, there are both in Boulder and Broomfield County, other teams in weekly, if not more frequent communication, also with the intramural sports and the different rec centers, and it's just any touches that we can have, as well as at the school districts level, where if we have someone that's remote learning, we're always trying to make sure there's no lens of, is anyone doing any club sports, intramural sports? So we're really trying to catch all those possible touches when we're doing a case investigation and contact tracing.
That's great. Thank you for adding that in. I really appreciate that. Laura from Whittier had asked, I have read the district considers BVSD in a hybrid teaching model. However, in-person elementary school teachers are teaching full classrooms up to 27 students per room at times in the building. How is this hybrid? I know that I did how is it safe with cases spiking, et cetera? Equitable was another question that she asked. I know that we did on our staff website talk about the fact that there is a difference in definition that the state has for hybrid versus what we were using originally in our plan, which was sort of the schedule was sort of a 50-50 mix of like 2 days a week at home. Jeff or anybody from public health able to kind of talk about it at the state level, they've kind of talked about hybrid at a level where you've got some kids at home and some kids learning remotely in a school. And so that's how they're breaking it down. Is that accurate?
Well, I just touched on that in my presentation, but I'll see if Chris or anyone else wants to add to that. We know from the data that we have much less risk at the K through 5 level.
I think if I could add just Jeff, since he called on me, I have to respond to the chief leader here. Again, I had a little PTSD from school there. Everybody knows this, teachers, staff, all of you as educators understand that K through 5 is a much more controlled environment. Clearly they follow the rules as they listen to directions, they do all the things that they want to do. And I think they want you to do. And they're easier to cohort, easier to do all those things. Now, having said that, probably Sam or Robin would know more than I do in the actual classroom setting, that by creating those layers that you've talked about, Randy, we're essentially creating a protected zone for both the teachers as well as the students. As you get to older groups, as you know, middle school probably being the most difficult to control from a behavior standpoint, but also high school students, their socialization is totally different. And they interact with many more kids outside of the environment. And I think we've talked around it a little bit in terms of outside activities, but as you get older, you're involved in much more social activities outside of school. And so all of the public health orders and trying to prevent community spread are trying not only to protect that coming from outside into the school, but vice versa. So I think we're trying to tackle this issue at multiple layers. Nothing is perfect, but we're trying our best to try to tackle not only from a population perspective, but an individual perspective as well.
Thank you, Chris.
Hey, Randy, the only other thing I would add to that is just that document that I sent you. I think CDPHE did a good job of balancing and weighing risks in that paper, and there's some links in there. So I would encourage folks to take a look at that. Okay.
We'll make sure to get that posted up today. This may have been addressed in that paper, and I apologize for not having a chance to look through it yet, but I know that there's been, Heather and our team and others have been in conversation around, additional mitigation efforts. One thing that's being talked about is lunch, and, typically in our lunchrooms, because they're eating in their cohorts and separated, there's, I think it's more like 3 foot of distance between. And so there's been sort of talk about, could they potentially, move that to classrooms? And so there was a question from, Sarah from Meadowlark that asked, is it safe for students and teachers to eat in the classroom without mask on? Our elementary schools are full class sizes. And specifically, she's asking about breakfast, which it sounds like is probably actually done daily currently in there. So I kind of jumped to something else that we were talking about as a possibility. But, again, we're in a cohort, Heather. So that's part of what the thinking is if you lower one of your layers of protection, then you've got other layers kind of protecting the kids at that point. But any further thoughts on that?
Yeah, I mean, I think this has been an ongoing discussion and balance, right? Students need to eat at school. For many students, that's where they get a lot of their meals. And so trying to balance that with physical space and what that looks like. I mean, I would potentially be interested in what Chris or Jeff or Jason have to say, but I think as much spacing as possible. I know you all are spacing, providing a lot of space between cohorts when there's any eating taking place. And again, if students or anyone have their masks off, that is lowering one of those mitigation efforts. So we want that to happen quickly, a short amount of time. I know this is potentially impossible, but not a lot of talking. Let's just like eat the food, get the masks back on. And yeah, I have small children, so I know that's not always a possibility, but I think it's one of those necessities that we have to kind of try to figure out how to do that as safely as possible. But if anybody else wants to add, please do.
And I think what you're kind of hitting on there too is really the key here, which is the balance between operation and working in school. And I think, right now, or at least in the last couple of weeks, the weather's been pretty good. And so the natural thing is, well, of course, let's spread them out, meet them out, have them meet outside. But then when, today is going to snow. And so then the thought is, in the worst parts of our winter, is that sustainable if that's a rule versus a recommendation? So I think that the recommendation has always been, if possible, social distance, and then, let's try to operate in a way that keeps our schools open and allows us to serve the students. So I'll just kind of say that. Okay, let me keep going on. Question that we got in regards to face coverings. I know this has been an ongoing conversation with our staff. Catherine from Transportation asks, Boulder County Hospital stated that bandanas, neck gaiters, masks with valves are not acceptable. These are types of masks that haven't been proven to be effective. Worse than no mask at all is what they put out in some sort of communication. I have not verified that. As a former journalist, I always want to make sure I make a note of the things I haven't checked out myself. But, why hasn't the district adopted a policy? I'm going to start with the public health side, and then, Stephanie or anybody, if they want to jump in on the district policy side of things. But face coverings are not all made equal. I think we all are aware of that. Obviously thickness and those kind of things. Where can who would like to start? Chris, go ahead.
I think we're splitting hairs here. People are looking for a magic protection. And look at the source here. Hospitals are saying, when you come into our hospital, we want to make sure that you're safe and everybody around you is safe. So we want to maximize the protection. So we want you to wear a strong facial covering. That's 2 to 3 ply facial covering, and wear it all the time while you're in the hospital. They're not going to allow their employees to wear anything but a surgical mask or a K95. Again, not only to protect them, but to protect their patients. So the higher grade of protection, and that's the N95 and surgical mask, are higher grades of protection, are appropriate in the hospital setting. Now, as you get outside the hospital setting, on the general public, our recommendations are a 2 to 3 ply cloth facial covering, usually cotton, that covers the nose and the mouth, and not play with it and not adjust it. Wear it as often as you can, both indoors and outdoors, and particularly when you're close to people less than 6 feet. So those are the recommendations. Now, obviously, if you have a single scarf or a bandana, that's less layers. You probably adjust it and play with it more. That the risk is less. So that bandana, scarf, those kinds of things are not recommended to be in a healthcare setting. So that's what we're talking about here. If you look, there's lots of data, and we can certainly send them to you, and you can push it out to the public. That on the one extreme is the N95, on the other extreme is a bandana. There is some protection with the bandana, but not sufficient to be used in a healthcare setting. So that's why BCH is saying that. Let's be very clear that we want to protect our healthcare workers and our patients in that setting. It's probably appropriate, okay to wear, and I wear a mask actually when I ride my bicycle or when I walk. It's probably okay to wear a bandana or a kerchief when you're out walking or riding your bicycle to protect you. But it isn't as safe as a surgical mask, and that's the spectrum. So we're splitting hairs, we're arguing about protection, but it's still part of that layering that we've talked about. I know I'm preaching here, but we're talking about not just masks. We're talking about physical distancing. We're talking about avoiding social gatherings, large groups. We're talking about washing our hands. We're talking about not going to work or to school when you're sick. If you do all of those things, we're going to do our good protection, not only within the schools, but in our communities.
Thank you, Chris. We have gotten some questions about quarantining. One of them was in regards to how Level Orange has changed the flow chart for quarantining, and whether or not that might be shared with teachers. I'm going to look to Stephanie to help us out with this. A couple others that we've gotten is in regards to COVID dashboard. There are categories for quarantining, including critical symptoms, symptomatic, pending results, and probable cases. How are those guidelines a little bit different for each of those? Why don't we start there? Stephanie, is that okay for you to start it?
Sure. So the major difference in how we look at contact tracing and quarantining based on the orange level is that in level 1 and 2, and I'm sorry, I don't remember the colors exactly. I know yellow was level 2. We could do 2 types of contact tracing or contact identification. Targeted, which we looked very specifically at who was right around the person who we know was positive or was symptomatic, versus standard contact tracing, which is looking at just the whole cohort. When we move into the orange level, we were no longer able to do the targeted contact tracing, and so we need to look only at standard contact tracing. So an entire class, entire cohort would go out on quarantine when we have somebody that is positive or symptomatic in that situation.
And again, the impact is going to be far greater. The impact's going to be far greater as that happens. It
could be right.
Yeah.
The other difference for us is that moving into the level orange, there is one difference in the way that we're able to clear students and staff to be at work. In the past, if you hit a certain time protocol or guideline with major or minor symptoms, you had to have a negative COVID test to be able to return and to be able to prevent a quarantine of the folks that you were with, either that targeted or the cohort. In level orange, you need a negative COVID test and an alternative diagnosis from a healthcare provider. And that, I believe, will be a significant change in level 3, and it could potentially make it much harder for people to get clearance to be able to come back.
Okay. Another question that we got that's pretty specific, so I'm going to just go ahead and see if maybe you're able to answer it or somebody else. For return to school criteria R3, how does the algorithm apply to childcare and children less than 3 years old, since they cannot wear a mask and it asks for a person to wear a mask? Does that mean that all children under 3 must be 10 days out from onset of symptoms, even if the symptoms resolve within 48 hours for minor symptoms and 24 hours for major symptoms?
So, yeah, I would love. Thank you.
We were chatting about that very question last week, and just got a response back to verify that the state agrees. And so if they're normally not necessarily wearing a mask, then it's okay to have them back as long as they meet that other criteria. So negative tests and an alternative diagnosis. So under 3 years old, we do not recommend, just for safety reasons and just wearability. So they would still be able to come back as long as they have a negative test and alternative diagnosis.
And this question kind of goes alongside of that. They say BVSD face mask protocol made on October 23rd states that students are required to wear a face mask. Why are BVSD permitting students to attend school without following this policy? There are 2 main reasons for that. As we just said, young students where it's not safe, students where they are incapacitated, they can't do it. That could be a danger to their life. And then the other one is special education. We're also balancing the need for education for those students. And so there is actually special guidance in that regard. Stephanie, anything you want to add? And I know I tend to go on a little too long and answer the question myself, but yeah.
Yeah, no, you're absolutely right. The other area I think that folks run into is that, it can take a long time, or can take some time for students, especially younger students or any student, to remember when the mask starts to fall down, over their nose, that they need to pull it up. And so there is going to be reminding, there is going to be some, constant kind of reinforcing of how to wear a mask and how to wear it properly. It doesn't necessarily mean that they're not wearing it. It just means that they need some they need a little bit of reminders sometimes. But you're absolutely right. Special education, we've got some special programming going on and looking at how we can provide additional support to staff who are working with those students who absolutely cannot wear a mask. But those students are also not going to be integrated into classrooms necessarily, where there are other students who are regularly wearing masks.
Perfect. Thank you. We'll turn, as a perfect segue, over to special education. I'm going to direct this one to Robin in regards to, Broomfield and Boulder counties have both moved to safer at home level orange. With this in mind, how was the decision made to allow the increase from 2 to 4 days for ILC and ICANN students? I know that this has been a long time coming in terms of us trying to serve those students better. What would you like to add, Robin?
Yes, Randy, thanks so much for that question. So really, this is in alignment with the conversation we've been having all morning, which is we need to balance access to education for students with the need to make sure that we are maintaining safety protocols for students and staff. And so what we do know is that very often our students in our most intensive special education programs really, really struggle to access their learning and make progress on their IEP goals without being in person. So we've worked very hard for quite a long time to make sure that we can get students back as many days a week as possible. Now, of course, we are paying very close attention to maintaining all the safety protocols that we've talked about today and we continue to talk about, while at the same time knowing that these students are among the students that need us the most. So we are working site by site, classroom by classroom, working with teachers, paraeducators, building leaders on being fully prepared to support these students in person, but to do so in the absolute safest way possible. And we are really excited to be having the majority of our secondary intensive programs coming back in person 4 days a week tomorrow. As you know, our elementary students have already been back 4 days a week. But most of the secondary programs will be coming back tomorrow, followed by a handful that will be coming back on the 17th.
And I do want to mention too, while I've got you, Robin, that we have, that this has been, with special education, we have been really trying to make sure that there's a prioritization there, right? That as our schools go out into remote learning, that if at all possible, that those special education programs are able to be brought back. And then I think that I don't want to speak out of school here, but if we are to have to go down to more remote learning for all students, that perhaps we're looking at a phase 2 in which we're, if at all possible, that we're continuing that educational opportunity for those students, knowing the impacts on them specifically.
Correct. We've been talking about phase 2 for a long time, in that we need to prioritize our learners who struggle the most, accessing learning in a virtual manner. And so as we go remote, you're right, we are working toward maintaining the ability to serve those students in person. So thanks for pointing that out.
Thank you. This question I think is going to be more for Mike Grados. It's still special education, but it's specifically about the paras. BVSD is offering hazard pay for paras willing to work for a specific student who refused to wear their masks. I think the better terminology there would be unable to. Other paras work with multiple students who don't wear their mask properly, may have saliva discharge, but they're not offering hazard pay for them. Why is that?
Good morning, everybody. Well, I think the problem here is that paraeducators who are working with students who cannot wear a mask because of their IEP, and that's determined in their IEP, they are working with those students to keep them safe, but also to keep others safe as well. So they're working, especially a little more, they're a little harder about how they're doing that. So it's protecting them, other staff members, for students who cannot wear a mask, okay, and protecting the student as well. So that requires a little more than the job description already describes within the paraeducator realm. So we do that because it's safer. Plus, I tell you, it's very, for some people, it's very risky for them to work, and they're wanting to do that, and the extra pay does come in handy. And as you recall, when we went into this pandemic, our food service people were given hazard pay as well to work with families and deliver food to our students. So I know it's kind of it's an interesting dilemma that we face with this, but I think it's more of safety. It's extra safety protocol. It's that extra safety protocol we want to put in place. So then we have to pay for that.
And I think just to add on to that, it goes back to our original conversation too about layers that somebody was talking about young children and how they have, we have to continue to remind. And so there is, certainly some acknowledgement that all of our students to a certain extent, may have to, continually be reminded and trained in that. But, when there's specifically a case where we can't have a mask worn, that we're taking additional layers in that too. Rob Price, I don't know if you want to add anything. I know that ventilation is always such on top of the mind. With those kind of students, we are taking additional measures in some of those classrooms as well. Anything that you want to add in that regard?
No, Randy, in those isolation rooms, health rooms, we're adding the HEPA air filters in those rooms. And then we're also spent a little bit of time going through the district and looking at other classrooms that we may have concern in. But right now, when our schools are being closed for either quarantine or staffing, we're going into those buildings, doing some extra cleaning, and then also verifying that the ventilation system is working as designed or as stated in our HVAC plan.
Thank you for jumping up there. I know, across the board, we've gotten a lot of questions on two different fronts. One is, and this will not be a surprise for our public health friends every time we've asked them on, there has been a question about the holidays and recommendations in regards to that. One of the questions that we've gotten is whether or not and some of the other, and I think part of this is being prompted by other school districts that are making announcements along the lines of this. CU Boulder also, considering going remote. Is the district considering going remote from Thanksgiving through the New Year? Or if we've rejected the idea, why? I don't know if Margaret or Sam, at this point, we're really heavily analyzing this situation and haven't made a decision yet or rejected it. Sam, anything that you want to add on that regard?
Yeah, I think that we're watching the data closely. We're continuing to work with our partners in our local public health agencies and considering things as they happen. So we know that other districts have made announcements that they might be moving in that direction. I think that we're still looking at that as a potential option, but no decisions have been made at this time.
The other one that seems to be really pertinent to people right now is the amount of warning. And so we've gotten a lot of questions in regards to, if we're going to go out. One of the teachers said, I have PTSD from March. I'm carting back and forth a wagon full of stuff every day. A little bit of warning to teachers would be wonderful. I know that the superintendent did say that to the extent possible, if we know that we're going to be switching down as a district, we will give as much warning as possible and that employees will be notified first. Additionally, we did have somebody on the Thanksgiving break question, say that, it would be helpful to know in advance because they'd like to send home project materials and that kind of thing before they go into break. I think we're all very cognizant of the need for that warning. But at the same time, we're having to also balance the idea that we have schools that on a day-to-day basis, because of quarantines, are having to go to remote, and that warning may not be quite as, we don't have as much of a warning about that. Maybe just that. The hope is that by that earlier in that afternoon, we're able to warn folks so that the kids can take home their Chromebooks and that kind of thing. Anybody from our administration team want to talk to that? And we are definitely trying to provide some warning, but it may not be days of warning on the school side of things. I may have said too much already. Anything to add? Okay, I don't see anybody raising their hand there. So, all right, I'm going to keep going with other questions that we've received so far. One of the questions that we got, this might be for Stephanie Farron with Partnership of Public Health. How does BVSD get its information about COVID cases? Is it self-reporting? If a child lives in a household with someone that has COVID, for example, would they need to be tested? I think that's a question that we get often, Stephanie. And then I'll just add another one, which is the idea that it is true that our COVID dashboard does not reflect cases outside of the school district. I don't know if there's anything that you want to say to that respect.
We get our cases all different ways. We are in, again, constant communication with Boulder and Broomfield County. Sometimes they get results and they pass those on to us. More often families get results and then they pass those on to us that way. There are some instances, as we know, of sports activities that are happening where there might be a case or a positive case or exposure. And sometimes we learn about those kind of through other folks who have been on the team. A lot of these club sports have kiddos from all over the place, so not just from BVSD, but from other schools as well. So it's a little bit of a puzzle sometimes, but I think we've been able to work really closely with both departments to make sure that that information is flowing constantly back and forth between us. If we learn of something, we pass it on to them, and vice versa.
And again, we don't in our dashboard, we don't highlight cases that are outside the district. I mean, that could get pretty messy pretty quickly.
Right.
And yet they are impacting our district.
Yeah, very true. We really are trying, because, especially right now, there is so many cases in our communities. We're really trying to focus specifically on identifying cases that have an impact on our schools, whether it's a quarantine of a class or other staff members or something like that. But we're not reporting on students or staff that are infected outside of school and then don't have an impact on us internally. And it can be confusing because we have positive cases, we have probable cases, we have symptomatic cases where if we go beyond the 48 hours or 24 hours, we need to quarantine. And, oftentimes those cases come back and they've had negative tests, and then we can release that class. It gets very convoluted and pretty tricky sometimes. And it's hard to kind of reflect that, I think, really well on the dashboard. And we want to make sure that the most current up-to-date information is out there.
Thank you, Stephanie. We've gotten some questions in regards to going back to the lower levels. I know that our public health friends did talk about, sort of the idea that the emphasis be on those elementary levels from CDPHE. I would say that that's definitely something that we as an administration have talked about. Again, no firm decisions in regards to that, but it's one of the options that might be considered as these things continue to progress. Just I will say that. Just trying to make sure we answer as many questions as we can before we go off here. The idea of, that there is lower spread amongst elementary, and maybe this is for public health, but lower spread amongst elementaries, but staff obviously would be considered adults, and then so there could be spread there. But again, I think the idea there is that we should be in cohorts and trying to avoid interactions between employees to the extent possible. Heather, anything that you want to add to that?
I mean, I'm not sure there's much to add that we haven't already said this morning, but yeah, I think making sure that folks aren't spending a lot of time together in break rooms or spending, any copying, folks are going one at a time. I know there's a lot of protocols and procedures set up for that piece, but I think thinking about where there's potential for staff to gather and making sure that's not happening.
Perfect. Sorry about that.
The only other thing I'll add, which I always try to close on, I think I said this last time too, is just how critical it is to not come to work sick. So if you are not feeling well, if there's a question mark in your head, please don't go to that family event. Please don't go to other outings or activities, and please don't go to work. And I know that's a big cultural shift for a lot of our society, but just, even if you're a little bit sick, that's where we're trying to say, please don't go to work if you're sick, and please, communicate that with your supervisors and with Stephanie's team, and just kind of helps screen and tease that out.
I did want to ask a question that we got from Kelly in IT. She asked, as our public health partners, would any of you take the vaccine when it comes available? Reminds me of the question that Fauci gets asked from time to time. Any of you want to venture a response, Chris?
Yes, I would. I think that I now have confidence in the FDA and And as we have a new leadership coming on board, that I do think that they'll pay attention to the science. And as the vaccine's released, I think we'll have a much more safe and less political process going forward. I think the data is still out. We have to wait for the data. And again, the questions around vaccine and data are all about, is there safe? Can I be safe? And really, that's what the question is being asked. And I think you can reduce your risk by doing all the things that we've talked about. And not only in the schools and all the policies that you've implemented, but whether or not you're in the schools or out in the community, if you practice these safe practices, then we will have a stronger, safer community as we wait for the vaccine. But we're still going to have to do these same prevention strategies because not everybody's going to take the vaccine.
Thank you, Chris. I know we're at our time, and so I just want to give our guest one last opportunity. If we miss something that we really want to say to staff, anything that you guys want to add, just raise your hand and I will call upon you. All right. It does not look like anybody's got their hand raised. So I just want to thank everybody from Broomfield County Public Health, Boulder County Public Health, those that serve both. Thank you, Chris, for that. Thank you to all of our administrators for being on here today. We appreciate all the questions that we got. They just kept pouring in. We will continue to add to our FAQ on the staff website with the answers to those questions that we've gotten. I also will be adding the CDPHE paper that we've had mentioned today. So I just want to mention that. Plus, as always, we'll be having this archived and put onto our staff page in YouTube for anybody that might have missed the show. So, Stephanie does want to add in real quick.
I just want to say thank you so much. Again, I really appreciate, I know we all appreciate the staff's help with this, that it's confusing, it's frustrating, it's scary, and I just want to make sure that everybody understands how much we appreciate them hanging in there with us through this. And thank you all very, very much. And please reach out to myself or to the nurse in your school, in your building, if you have any other questions or you need any help with anything. We're there for you.
Randy,
Sam,
can I say something? Yeah, I just want to say, I mean, I know that with the data trending the way that it is, that this is a scary time for staff. And I just want to acknowledge that and acknowledge that's real. And that I know a lot of you are probably feeling some anxiety this week as you see the numbers rise. I've been out in schools personally, and I've been really, I found it really affirming that our kids are really following the safety precautions, especially at the elementary level. I think our staff is doing an amazing job of keeping people safe. And I just can't even begin to express the gratitude that I have for all of our staff who are working directly with kids right now to keep that education going for them.
Thank you for saying that, Sam. Mike, did you want to add something here as well?
I would just ditto what everybody's saying. I just think it's a tough time. A pandemic is an interesting time. It's not something you thought you never would have experienced in my 40 years in this experience in this business. But I think what Boulder Valley is doing along with the health partners is just outstanding. Outstanding. I have a lot of relatives in the district. I have lots of relatives in the Lafayette-Louisville area, and they're just very complimentary of the health department and the communication that they're sending out. So you guys should be proud. So thank you.
Thank you for that. All right, any last ones? Okay, got a lot of thumbs up. I just want to, just one last time, bring up our panel here on the screen just to say thank you to all of you. I know that you are very, very busy people during this time, and we appreciate what you have done for our community. Continue the great work. And thank you for waking up with us, BVSD. We hope that you have a great rest of your week. Thank you.